And what I would start off with is we care when you are not aware.
Yeah.
So anesthesiology is a wonderful field in the clinical subject, which is one of the main pillars, I would say, if not the backbone in the clinical subject, and especially in all the surgical fields. So to give an overview, as Dr. Kishan told, this is one subject that as an MBBS graduate, you're not much exposed to. You have some idea in, I'm sure you have learned a couple of topics in KD Triparty, pharmacology, all the
drugs, common drugs used.
Yes, drugs come in that. Then local anesthesia and local anesthetics. Then slowly you will learn when you go to specialty subjects, you will learn about little bit about spinal anesthesia and general anesthesia. So what I would like to say here in anesthesiology as such is we are perioperative physicians. What I mean by perioperative physicians is take care of the patient pre-operative, intraoperative, and also post-operative. So what is this? How can I give an overview when it comes to this? I'll just let you know. So any patient who is posted for surgery, okay, now I will come to this anesthesia field as now when a patient is posted for surgery. So pre-operatively, we have to see whether the patient is fit for anesthesia and surgery. So how to make sure? So pre-operatively, we do our routine PACs. PAC stands for pre-anesthesia check. Okay, so we have a detailed examination of the patient. We check whether the patient is fit for anesthesia, whether he's got any comorbidities. If at all he has got some comorbidities like hypertension, diabetes, which is uncontrolled, we make sure we control it before posting him for surgery. And before we say, okay, tick, is accepted for anesthesia and surgery. And Dr. Kishan can go ahead with his surgery. Okay.
No, this is very
intraoperatively. Yes.
We are in a hurry to operate. Okay, but without anticipating or without looking at these aspects, because we are only concerned about our surgery. Without looking much into these aspects, we in a hurry to operate. But because of you people, we will be saved post-operatively or intraoperatively. Because intraoperatively, if the blood pressure is very high, it will be bleeding like anything, and it will be very difficult. It will be very stressful for a surgeon, and many things go wrong. Yes. Because you check so in detail and you give us a feedback or to tell us to control before the surgery, we can have a very peaceful or stress-free surgery. Very important.
Yes. And once now this patient is completely fit for anesthesia and surgery, we take him to the operation theater. We plan, obviously we have planned whether we are going to, based on the surgery, whether what kind of anesthesia to be given. So intraoperative complete management is done. So I will not get into the nits and grits, but complete management intraoperatively, whatever the surgery may be. Now we have gone to all latest kind of surgery. Actually, Shilpa is expert in robotic surgery. So anesthesia for robotic surgery or whatever it is. So Kishan is an extremely good laparoscopic surgeon. So laparoscopic surgery or whatever it may be, the patient is posted, we take care of him with the anesthesia intraoperatively, and then once the patient comes off anesthesia and shifted to the PACU, that is post-anesthesia care unit, that is post-operative unit, there we also take care of the pain of the patient. So we are also called as pain physicians. So this is something that I wanted to tell. Post-operative also, our work is not done. We take care of the patient post-operatively. If at all it demands that the patient has to be shifted to ICU, there too, if the patient needs like some major surgery, esophagectomy with the pull-up or whatever, he has to be paralyzed, sedated, and put on tube and put on mechanical ventilator. ICU is another field now, which is taken care by anesthesiologists, along with the, if at all, intensivists also are there. It's another specialty that will come to that later on. But even in ICU, we take care of all these patients. And so this is something that perioperatively we do. And also, what I want to tell is anesthesia is now broadened into variety of other avenues. That is chronic pain management, acute pain management. So Shilpa has done her fellowship in acute pain, and I myself have done in chronic pain. So what we talk about is if any patient will come with trauma. So on arrival to the casualty, anesthesiologists who are specialized in acute pain management will go there and take care of, imagine some multiple fractures, rib fractures, and other things, long bone fractures. You go and take care of his pain there, and then shift, stabilize him, and then shift to all the other investigations. And also, what I mean by chronic pain management is cancer pain. So anesthesiology is also ventured into cancer pain management. So there also we treat all the patients who are having a variety of cancers with morphine and other interventional blocks like celiac plexus blocks and other things, and also for facet joint or transforaminal steroid infiltration and other things. So anesthesiology has broadened its and it has multiple avenues now. So we are not. Also, one thing what I want to tell is, if at all, for whatever reason, many of the students they land up in either by choice to anesthesia because they fail to get any of the other clinical branches. Then, if they have done it by choice, well and good. If they have landed by, okay, they couldn't get other seat and ended up in anesthesiology, another horizon that is opened is you can go into intensive care, complete intensive care, okay, as an intensivist in the hospital. So that is also after the super specialty subject, after anesthesia, MD or DNB, you can go ahead and venture. So this actually is one overview what I have given, Dr. Kishan.
Yeah.
To all the
By that, overall,
viewers.
what Govindraj meant was, first thing, anesthesia is not confined itself to OT alone. Earlier, we have a notion that anesthesiologists work only inside the OT all the time, managing the patient. No. Now the branch has widened its horizon in a way that you can direct have a, like, as a clinician, as a physician also, you manage the pain in the OPD also, in the casualty also, in the ICU. So so much of interventions have come up. So you are multifaceted as anesthesiologist, not just working inside the OT, but you have multiple other tasks as well. One thing is that. Second thing, the second part of his this thing was, see, in love also there are two types of love. Okay, one is before marriage, one is after marriage, love after marriage. Okay, if in arranged marriage. So here also, if some people have by choice they have taken anesthesiology, okay, they are already in love. But if some people have landed just because they have not got the anesthesiology, after getting into the branch also they can still love the subject. So it's so good, they can fall in love with the subject and they can be the best anesthesiologist possible. Very well said, Dr. Govindraj. So, Dr. Shilpa, why you think I should take up anesthesiology? Why anyone take up anesthesiology?
Yeah, if I can add on to what Govind already said. So anesthesia as a branch, the importance is such that it is one of the main backbone of the entire healthcare system. Okay. So if you think of a healthcare system, you can probably have a healthcare system where it's just a gynac center, or you're running it just as a urological center, or whatever it might be. You can probably refer out a patient if a urologist is not available or a neurosurgeon is not available, or for that even matter, a physician is not available. So you can just send the patient out for diabetic management or anything like that. But it is not technically possible to run any healthcare setup without an anesthesiologist backup.
Definitely.
So yeah, for any emergency management or proper management of a patient, an anesthesiologist is always required. So for anyone who asks me what's the importance of anesthesia, I feel it's as simple as that. It's not possible to run a healthcare system without its main backbone, that's the anesthesiology.
I have seen many hospitals where a surgeon may be visiting, a physician may be visiting, physician, orthopedician may be visiting, but they'll definitely make sure that they have an in-house anesthesiologist available all the time.
Right.
Okay. So that's a mandatory. In any hospital,
yeah.
There may not be any physician or surgeon or anyone, but there will be mandatorily, there will be a all-time available anesthesiologist. So that shows how critical or how crucial they are in our field. So coming to a residence perspective, I've got a decent rank in my recent NEET or INICET examination. So I'm in a dilemma now. So yes, I have in back of my mind that I want to take up anesthesiology. I asked my seniors; they also told it's good branch. Now you also recommended anesthesiology is good. There's nothing to repent if I take them. But where to take? Where there are multiple options. Government colleges are there, where patient load is high and there is a fees also very less. Private, where all the latest advancements are there, all the regional anesthesias, everything will be given routinely, and all the USG guided blocks, everything I can see in private. Okay, so where I can get into very peripheral colleges, wherein there is a lot of even the super specialties also comes under the general anesthesia only. So I can have lots of hands-on, or in central institutes wherein I can learn in a very protocol-based training. So where to take and how to take, how to choose the college, whether
so when we come to this, there are pros and cons to both. So if we talk about the government colleges, the patient load is better. So obviously your exposure is going to be better. The kind of cases you see and the severity of things you manage and the complications you see and the number you have is probably more. So that is definitely a benefit when we talk about the government colleges. At the same time, we have a setback, like the teaching system wouldn't be great. Because of the great number, you wouldn't be able to concentrate on each patient in the way.
Working.
Right.
You finish off the job. Your only aim is to finish off the cases per day.
Especially for anesthesia, when you want to finish off the list by the end of the day. So it might be a little difficult to give that care and understand each patient necessities really well. So when we talk about the private colleges, I would say that usually the number of patients that's required for an anesthesiology resident to learn really well doesn't really compromise in a private college, because you would be providing anesthesia to all kind of surgeries and to all departments. So even if your particular institution has a little lower number of ops cases or a little lower number of any particular department, it will be made up with the rest. So the number of patient or exposure usually for an anesthesia resident is not a problem in a private college. But also the benefit is that usually the infrastructure is good. You have great equipments, especially the airway gadgets. You see all the newer gadgets and the fiber optic. You know how to manage even the worst scenarios where the airway is difficult or you're not able to like mask ventilate or intubate. You know how to handle such situations. So you become a more confident anesthetist. And also you can work with ultrasounds and the recent workstations and all the equipments, which will make your anesthesia practice better. So there are pros and cons to both. So when you're trying to decide on the college, two things that you can concentrate on is what is the infrastructure available in that hospital, how is the teaching in that hospital, and what are the equipments that you have. Also, a decent amount of patient load should be great enough, because 3 years of residency in anesthesiology, the learning curve is not much. You'll be able to pick up even if you don't have a great patient load. So a decent hospital with a decent patient load with great equipments would be a good choice to take up anesthesiology in.
Also, remember one thing, when you're choosing, central institutes are always good. See, I have worked closely with a lot of Tata Memorial Hospital, is very close to my heart. So I have regularly visit the hospital, and also some other AIMS, New Delhi. So I know a lot of professors there that teaching program, everything is excellent. The caseload is obviously very good. But when it comes to certain other things, like they may not have certain departments may be lacking in certain cases, so and other things. But Kishan, remember that central and government institutes should always be the first choice.
Yes.
Because you know, see now the rising cost of education. And this one. So you get your in private colleges is very expensive. The last I know in private colleges, I think the fees for NEET, it goes around 20 plus lakhs. Okay, per year. It's a 3-year course, so 20 plus lakhs, and central institute and other things. And the stipend in private colleges is around 40 first year, 45 next year, and 50 the final year. But in central and government institutes, what happens is the fees is almost negligible.
Yes.
So
And
so I think yes, that should be the number one choice. If at all you fail, as in not achieving certain good institute, but I think the other option would be to stretch a little bit, if possible, and go for private institutes.
Is there any difference between MD and DNB?
Not really. If I would definitely have an option, I would definitely pick a MD, which I've already done. So if you have an option of choosing between MD and DNB, definitely go for MD, because in an Indian scenario, I feel MD still has the upper hand. But if you think in terms of promotion or how much you can earn, and in that respect, then I don't really think that MD or DNB makes a difference. You can opt for either. Especially, you can finish your course and then go for freelancing and everything. So, in that perspective, it really doesn't matter. But if you're thinking of growth in a medical college or that kind of picture, then definitely MD would be a better option.
Yes. First choice always you go for. This is what my guru also used to tell, Professor Dr. Ravindra US. So he always told that go for MD degree always. But unfortunately, whatever reason it is, if you don't make it in choosing, in getting the MD, if DNB is an option, go for it. Then probably if you have another attempt at, you can go for MD later on also. That's not this one. Another option is here. Not only DNB, you have diploma in DNB also now. I think most of the colleges are scrapping the DA, that is diploma in anesthesiology. Now they have something called as DIP DNB, diploma in DNB. That is most of the private hospitals, they have some institutes. It's a 2-year course. Okay, so 2-year course, and then if the person wants, they can go ahead and do MD also or secondary DNB also. No, not of this one. Okay, so. But always, we suggest that go ahead with doing MD.
If it's an option.
It's an option, yeah.
So I don't think, other than the in the academics, in the medical colleges, degrees doesn't matter much, because the patient doesn't know your degrees, and the work you do doesn't depend on your degree. It will be same either if you do MD also, DNB also. So
yes, at the end of the day,
please take it.
Right.
Yeah. Because what I have seen in my experience, as years go by in your attempt to write in NEET, very few I have seen.
Goes down.
Yes, the graph is always going down, and your efficiency comes down. First attempt is always the best attempt, and then whatever. So it may not be true in all the cases, but generally, in general, it's the case. Yes.
Dr. Shilpa, see, there are three. I have decided that I want to take up anesthesiology, and I have decided the college also. So what should be my preparedness or strategy for 3 years of residency? There is some notions in my mind, like I should be spending entire my 3 years inside the OT, no, not much outside clinical exposure or like patient interaction. So many things will be going in my mind. So what should be my preparedness? Okay, I should be prepared for, or should be my strategy? And what about the thesis, studies, and the stress management? Is there any? Because I have seen my anesthesiology P's and all slogging overnight and all, with especially ops cases. Or entire night they'll be doing cases, and next morning the long list will be awaited. So a bit stressful also. Anesthesiology is not so simple as we think. So how do you really manage the 3 years?
First of all, what I would like to say is, as we already discussed, anesthesiology is a very demanding branch, because you're not just required inside the OT, you're required elsewhere too. May it be providing sedation in some peripheral setups like, MRI or CTs or, anything like that, for endoscopy suite and so many other places. Or you might have to provide a CPR in a code blue attempt and so many other places where you are required. So it's a highly demanding branch. So at this point of time, it becomes also extremely hectic for a resident, and also in the long run as you take it as your career. So definitely it's going to be a hectic branch. So I would say the most important thing is for you to be mentally strong and to prepare yourself well in advance, that you're going to deal with a lot of emergency and you're going to be a lifesaver. where you're
exactly.
kind of going to make a real difference in saving the life of the patient. So it's as serious as that. So the mental makeup is extremely important. You need to be really prepared, knowing that it's a very serious subject and you have to deal with a lot of emergencies. So once you're done with that, talking about the
So
PG course.
when she told me about, I just remembered when she told about being the calls of cold blue and other things in the hospital. I remembered my first year as a resident. Okay, so first year as a resident, I was called at at around 2 o'clock or 3 o'clock on my duty day for code blue in ICU. So I went there and I did the laryngoscopy and I had to intubate the patient. So unfortunately the medicine and other people failed to intubate. So like after intubation and successful reviving the patient, they all were like, whoa, awestruck with the anesthesiology resident. Okay. So, but here one thing. So I am a postgraduate guide also as a associate professor in K. Segade Hospital. So what I tell my student is these 3 years are most important. So you have to be ready for a lot of things. It is not easy. Nothing comes easy in your plate. If you, so be it the anesthesiology more so is a little more demanding. So and so forth. Other clinical branches are also very demanding. Because why am I saying this is it starts with duties. So first year is called JR1, second year is called JR2, final year and it's called JR3. So they generally have somewhere around 8 to 10 duties a month. So 24 hours you're in the hospital as an anesthesiologist. And as Dr. Shilpa told, you will get multiple calls in the hospital, like be it for as silly as not getting IV line for a patient in the ward, okay, and putting Riles tube. And so you have to get up and go yours. So hardly you will have some amount, little bit of sleep.
Any
Yes.
pediatric case comes, foreign body removal, sedation, so many calls.
So many things, and you are getting calls for code blue. You are getting calls for pediatric IV cannulation, which is very stressful. Okay. So, and it all comes in midnight and other things. So
arterial lines, central lines. So.
Yes. And if you have a bad case in the OT, then obviously you had it the entire night. But why am I saying this is your duty, you are doing the duty. Next day you will have to do your list, that is whichever OT you're posted in, and then also attend the PG teaching program. So you have to have a lot of energy. So one thing what I tell all the postgraduates is these 3 years, just you have to slog and concentrate, and you have to work hard. There is no shortcut in medicine. There is no shortcut here also in anesthesiology. You have to work hard. Coming to thesis. So initially within a couple of months as JR1, you will be allocated a guide who will help you in choosing a topic. So you will have to come to him or her with a couple of about 10 to 20 topics. They will select a particular topic. So here remember that the whole point of having a thesis, that is a topic, is to encourage research in postgraduate. So one of the things that is happening now everywhere is to encourage research. So here the outcome doesn't matter of whatever study that you're doing. Okay, what matters is the process. You have to be honest to whatever study you're doing. Okay, don't. I see a lot of. Okay, let me not talk about the this one, but you have to be honest to the study that you're doing. Okay, and because the methodology, everything is very important, and here that is what we look into while doing the outcome is irrespective, because most of the studies are observational studies that are happening, and this one. So thesis starts with the protocol presentation, then to the ethical committee, and so on and so forth, all the things, and finally you have to prepare the part 1, part 2, and so on and so forth. So then what I want to stress here, tell is in these 3 years, you start your I had my colleague, I'll never forget him. He was a Bengali who did MD with me. So you know what he did the first day he joined Kishan? In the HOD's room, there was a calendar. And later that evening, he saw the calendar and he's like, Dr. Govind, so we have 365 days into 3.
Okay.
I will start taking every single day, one, and I'll start counting. So, some people do that, but the intense work is required. Also, from day one, you have to spend time in the library. What I say is, if you, there are some reference books which are very expensive. If you can't, not able to buy, it's okay. You can go to the library. There are
There is no going to library. Everything is e-library.
Yeah.
All expensive books are there in this one expensive.
Yes. So probably I'm old school.
Yeah,
I'm not used to.
I have seen residents, unnecessary residents, after inducing, they will be with their
iPad.
They will be studying all the time. In that way, it's good. Anesthesiology, you'll get a lot of time to study also simultaneously.
What we want to tell you is that it is not only the subject, dear postgraduates or budding doctors. It's not in anesthesia. You don't have to read only anesthesia. You have to know even what Kishan does.
Yeah.
He might be operating somewhere close to the major vessels.
Yeah.
Okay. So if you are not looking at what he is also doing at the same time, and you don't know what are the structures or what are the important structures close by to where he's operating, okay, it is not good. So you need to know about the surgery and the anatomy.
Yes.
Okay, you need to know about the pathology and multiple other things, also physiology, obviously. So there is a lot of reading to do, dear budding doctors. There is a lot of reading from day one. Okay, don't think that it is an easy subject. Many people consider anesthesiology and radiology as very easy subjects. One of the most toughest, according to me. Okay.
Yeah, you have to know about everything, orthopedics, obstetrics, everything, all the conditions you should know.
Right.
To give example, yesterday only, Dr. Govind helped me. I was doing laparoscopic surgery, and patient was somehow not doing well. Then suddenly, Dr. Govind reminded me, I think the carbon dioxide pressure is little high. Okay, it's high, so please bring it down, he told. Then I decreased from 15 to 12. Then the patient suddenly became all right. So you have to know in detail about the laparoscopic aspects also, all the surgical aspects also. Only then you can manage a patient better, or else you will be not knowing what's really happening.
Absolutely. That is called eternal vigilance. Okay, something that we have always bank on. That's eternal vigilance. You should not be distracted with newer gadgets in the OT. Don't have always look at WhatsApp and other things. So you have to clearly monitor the patient. Okay, and another thing is this: just because these 3 years are very intense, okay, you should have your relaxation too, whatever it is. I tell my postgraduates, okay, it's okay. Weekend, couple of hours you take off. If you want to do every single day yoga and other ways of relaxation, it's okay. No problem. You spend some time. You always spend some time with the family. Talk to them, because if you're hostelite, you will be always in the hospital and hostel and other things. You cannot manage stress at times. So have a goal. From day one, that is only 3 years, you will be done with it by the end of it. So you have to take the bitter pill and go ahead. So start loving every single day with the subject. So once you start working hard, then things will be very easy.
No, it's very important to have a very relaxed mindset for anesthesiologists, because very stressful things, because patients' vitals are going up and down. If your efficiency is not good enough, no, you cannot manage at all. If you're hypoglycemic, I have seen always when I was in AIMS also, Sri Chitra also, senior anesthesiologist always send the juniors first for the lunch time. At 1 o'clock, they send there, please go have food and come back. So they make sure that they have food in time, sleep well, adequate sleep. Okay, because this helps in the efficiency of the doctor as well. Okay, so that's in UK, if someone is overworking more than 8 hours, he'll be fined, or he can be suspended, just to make sure that his efficiency is full. So that is required.
Yeah.
But when we are saying this very repeatedly, I don't want the students to also panic and run away from anesthesiology. What we are trying to say is, it's a very serious subject and you need to have a very strong mental makeup for it, but it's not impossible. It seems difficult in the beginning, but with time and experience, you kind of get confidence and you learn to deal with all the complications that can come. You learn to anticipate it and probably prevent it even before it happens.
that is why, Dr. Kishan, what we have in our program is in our MD program, because as you started off with this talk with by saying that anesthesiology is subject which you are not exposed to in UG days. So we give some time for them, about a quarter, that is 3 months, as orientation.
Yeah,
we have a lot of classes from the professors. All basic topics are covered, and you have a mentor. So you have all the topics, basic topics, and all these classes are going on during these 3 months, and you do a lot of observership during these 3 months. So that helps in knowing things, and some simple, some initial that books, that a couple of things, that is what we recommend, are told to them, and certain topics, certain notes are given to the students, and that's how they get oriented first to anesthesiology as such, as a subject.
Now that I have taken up anesthesiology with interest or without, but ultimately what my aim is to become the best possible anesthesiologist. Okay, like you both, I also want to be a more sought after. Everyone should call me for the cases, minimum 5, 6, 7 cases I want to do every day. So can you please give me 3 key keys for success, if you can, your experience, Dr. Shilpa?
Yeah, keys for success, I would say that, try to be really calm and try to analyze what the situation is before, you really jump into it. And I always feel that anesthetists, your reflex should be really fast. Okay. You think fast, and you reflect, or you act even quicker than that. Okay. Great. So anesthetists are usually very quick on reflexes. So you need to train yourself to develop that, and be kind of quick and think fast. At the same time, it gives you a lot of satisfaction with what you do. You are basically considered as lifesavers. So there will be some situations which can be very gratifying as an anesthetist, where you actually make a difference and kind of save life of a patient. May it be like emergency intubations, or some emergency procedures. So you would definitely not regret taking up anesthesia anytime. And then other than that, I would like to say, whenever we are talking about the pros of anesthesia as such, the learning curve is not very vast. So it's not really very steep. So by the end of 3 years, you are ready to freelance.
You can manage. Yeah.
You're definitely very ready to freelance or work in institutions or do cases very independently. So if you have really worked hard for 3 years, you'll be good to go after that, which is a really good thing compared to any surgical branches or other branches. Your kickstart is quite good. So definitely work hard, have a strong makeup, and be confident that you'll be able to manage your cases well.
This is something new. I have done interviews of so many and many branches, but this is the first time even I have got an insight like this. Some really different keys for success. Like, one is to have a very cool and composed mindset to can tackle any situation. If you are having very difficult to have, but very important. Second thing is to have a very quick thinking and to develop the quick reflexes. And third thing, yes, we should love with the subject, and also make and realize that this is not just a OT job, but it's very multifaceted, and you should be ready for everything. So,
yeah, see, anesthetists always have a plan A, B, C, and D. We are always sorted that way. Okay. So if plan A is not going, you already know in the back of the mind what you're going to do next. Okay. So for that, you need to be really calm and handle the situation very nicely and not panic, because you would have learned that with experience and time. You would have seen so many things like that. So you would know probably what are you going to do next. So taking the subject seriously and working hard is what counts the most. Nice. With time, you'll be able to handle it all.
Govind, you want to add something to that?
I would add a couple of more points, saying that number one, as anesthesiologist, you have to be street smart. Okay. So see, whatever said and done, at times you will be called by surgeon. If you are not open or talkative, or you don't have a broad group of friends or surgeons as your this one, then probably you will not have that much cases. So you need to be
Extroverts.
available
Yeah,
also.
available and extroverts. Yeah.
And available. What I mean by being available is
Dedication.
yes, dedicated towards the field. So it's not that, today is Saturday, I will not take any calls. No, that's not going to work. If Kishan is posting a case at Saturday 10 p.m., you have to go for it. So you have to be number one, available.
Okay.
So that is one thing. Another thing, what I want to say is have slight edge over others.
Okay.
So you asked us about how to be successful. Okay.
Yeah.
If you have, and how surgeons will call you. So one being street smart, one being available 24/7. Okay. I don't say that you should not take breaks. You can take breaks, but when you are not, when you are working, you be available and not be lazy. And at the same time, you should have some extra talent, extra knowledge.
I call Dr. Shilpa for my cases just because she's expert in regional anesthesia, regional blocks.
Yes.
Unnecessarily, it saves my patient from undergoing general anesthesia or some spinal anesthesia. Just gives regional blocks. Even Dr. Govind, for that matter, he gives nice USG guided blocks, regional blocks. So my patient's also happy. I'm also happy. So that way, I prefer them over other anesthesiologists, maybe. So like that's what he meant, to have an edge over others, little more talent than normal.
Yes, truly true. And another factor amongst youngsters that I want to stress is to be successful, you have to work hard.
Okay.
There is no shortcut. Okay, just everything will not come into your plate and it will be ready to be served. So you have to be working very hard. Yes.
Basically, you're like the pilots of the plane. So when the pilot is flying the plane, if you're not calm and composed, and if you start panicking, you'll panic everyone in the OT, including the surgeon and whoever is involved in the surgery. So you being confident and working hard and being dedicated is what counts the most.
So one thing I want to tell Dr. Kishan, in the training, few centers in India, they have like state-of-the-art simulation centers. Okay, especially very, very helpful when it comes to crisis management in anesthesia. So we have a lot of topics like anaphylaxis, then other things like syncope, vasovagal attack, and then some dental emergency or some bronchial asthma, acute exacerbation. So certain topics like these, we run drills on the mannequins so that our postgraduates are well prepared when it comes to crisis. So crisis management is something that we train all our postgraduates. So simulation is coming big time into medical field. Yes.
What's the way ahead? I finished my MD or DNB anesthesiology, and what's next? Can I, as you told, I can independently practice, or I have various fellowship options, or is there like I think DM also nowadays, cardiac anesthesia, neuro anesthesia. So how to go about?
Yeah. So I'll talk about practice. So once you're done with your MD, so you can plan on joining a medical college, which I recommend to most of them. So at least from 9 to 4, if possible, join a medical college. And because as a beginner, you will not know, you will do post-graduation maybe in one part of the country and then go to your hometown and settle. So there you are totally new. Nobody knows you. If you directly jump into private practice, Dr. Kishan or Dr. X, Y, Z doesn't know you. How they will start calling you?
Have a backup.
Yes. So something for constant income or source of income, once you're done with your hard-earned, 3 years of education, is if you're planning to directly venture out, is to join a medical college. Okay, 9 to 4, you have very good now vacancies are available in almost all the centers. Especially when I talk in Mangalore, more than 7 medical colleges or more than 4 or 5 medical colleges have got vacancies for SRs, and they pay very handsomely. I would say, especially in Karnataka, for all the viewers in here, I know that pan-India viewers are there, especially in Karnataka and in Mangalore. The pay is very good for SRs. And so 9 to 4, you know what, you join a medical college. Then you can visit a couple of nearby. You can set up like one perimeter around your house, maybe 5-6 kilometers around, or less than 5 kilometers. Go and visit all the nursing homes, hospitals. Give your card. Okay, tell them that you are so and so anesthesiologist. You are practicing in you are in medical college from 9 to 4, but after 4 I am available for most of your cases. If at all anything is there, I will come and I will attend your calls. Also, once you join a medical college, you are exposed to Dr. Kishan, Dr. X and Y, and so many people. So
They also call you
they
for the
have
private.
some cases they will call outside. So regarding myself, I had a very good opportunity from Justice K. Segde Hospital, who sent me for. They wanted a person to do some training in fellowship in chronic pain management. So they sent me to Kidwai Institute for chronic pain. So Dr. Shilpa will be a very good, because she immediately after her MD, she got after her MD, then she did her DNB, then she got her matched for fellowship in Ganga Hospital. So she will talk about super specialty and fellowships.
So you have a lot of options once you finish your, MD or DNB. So I feel it all boils down to three things. What our undergraduates would want to know before they, pick anesthesiology. So how fast are you going to settle?
Mm-hmm.
Will I get a job once I'm done with my 3 years of residency? How well I'll be paid?
Okay.
So, and what's the scope beyond just MD and DNB? So I think it all boils down to that. So how early you'll settle, I already told you that you'll be good to go by the end of 3 years. You'll be able to manage basic of neurosurgery, oncosurgery, obstetrics, general surgery, cardiac might, orthopedics. So cardiac might need a little intense, training. Other than that, the basic cases you'll be able to manage really well by the end of 3 years. So you can start off a career right after your MD or DNP.
It's an end specialty.
End specialty, yeah, we could probably put it that way too. Looking for job opportunities, the ratio is really high in anesthesiology because you are required in a lot of places and for all departments. So definitely the job opportunities is much more compared to any other branches. How well you'll earn, it is believed to be the second highly paid job in India. So definitely not more than a surgeon, but if you have 10
Please
good
tell
surgeons.
once again. Please tell once again.
But I believe if
Twice
you have
is the second most paid, so you should minimum tell twice.
Yeah, if you have 3 or 4 good surgeons for you, so I think you'll be good to go. You'll settle pretty early. And next thing is about what do you need to stop at MD-DNB, or you can go further. So it is a very individual perspective how you look at it. It all depends on what you want to do, how much time you have to invest, and where you want to settle, and what's the scope there, what's the scope of super specialization there. But if you're willing to super specialize, there are a lot of branches that have come up. There are DM in cardiac anesthesia, neuro anesthesia, pediatric anesthesia. Now even onco anesthesia has come into picture, organ transplant anesthesia. So there are a lot of options. Even you have a lot of fellowships in acute pain, chronic pain, and PDCC with, just critical care. Critical care DM is one of the hotcakes now. So you have a lot of options even post MD DNB if you want to pursue your career further and, take yourself into one particular path. So let's talk about a set of students who are not happy with anesthesia. Okay, you have taken up anesthesia, you have done your 3 years of residency. It's too much of stress. You're not able to handle this lifestyle and, emergency calls running here and there, not sleeping, you're not able to put up with it, cope with it. So is there an exit route? So what do you do after that if you're not able to like it? So I would say that, you still have exit routes. That is, you can go into, a fellowship or a DM with critical care, where you'll go completely as a physician into,
ICU.
Mode of ICU setup. Or maybe you can go into pain management, have an OPD of your own, not be dependent on a surgeon, and have your set of patients, especially for people who, don't like being the unsung heroes, or, don't like being behind the screen, who like being there in the forefront. So for these people, pain is also an option. So you can, go into chronic pain and have a OPD and practice of your own. So probably you'll be a little more independent compared to a conventional anesthesiologist.
Multiple new avenues are open. So whoever have had disheartened with not able to open a clinic or whatever it is, so as she told, can go for pain. There are a lot of pain fellowships in India now. Daradia in Calcutta is one of the major centers. They do a lot of cases, and then set up. You do a fellowship and come back and set up a pain clinic in your town and do interventional pain management. So, and also like ICU and a lot of other new avenues are open.
There's also one more benefit of anesthesiology, that is, though you're not in the forefront, though all your patients don't know you, it is possible to make yourself visible, do a good pre-anesthetic
My next
checkup.
question actually. See, only cons I feel about anesthesiology maybe may not be true, but still I feel they are not given the due credits.
Yeah.
Because everything is totally managed by them in the maybe in the OT, ICU, everywhere. But they are always behind the screens. Always surgeons go front and take all the credits as if they have done everything. The anesthesiologists are not given the due credits. So that's the one aspect most of the students are worried or think twice or thrice before taking up anesthesiologist.
Correct. Now we are also working on Know Your Anesthetist campaign. Where we are trying to, increase the awareness about anesthesiologists, like what they exactly do, why are they important, why is it important to choose a good anesthetist. So I would say, like, to all the new budding anesthetists, please go and talk to your patient, introduce yourself, give them a variety of options that they have, tell them why you should choose a particular options and why it would be better for them. So they will remember you as their anesthetist. Also, go pay a visit post surgery, be there for the surgeon when they need help, in the management post-op also. So there are quite a lot of ways to make yourself visible and, for the patients to know that you exist and you are a part of their care. They are going back home because you are there to help them out. So it's not really hard to be visible if you are pretty much dedicated. Also, there is other way of looking at it. If you're a person who is very introvert and you don't like talking to patient, probably Kishan can't go on a vacation without having calls for a week. I can switch off my phone for a week and not be there and decide not to take calls for a week.
Don't want to work in very hot climate and all. For them also, is good.
So your interaction,
18 degree. Okay.
Yeah. So your interaction with patient is very short term in anesthesia. So it's about pre-anesthetic and probably 1 or 2 days post-op till the patient is stabilized. So you can always have your time off where you decide to not do cases for 3 or 4 days or things like that. So that could also work in your favor.
I have seen some very good anesthesiologists where they always make their presence felt, especially to the patients, by explaining things very well. Okay, very well. Otherwise, all this usually done by the surgeons in our country. Usually in the OPD, they will only tell spinal anesthesia will be given. There is a back small injection will be given. All this explained in a very crude and rude manner by the surgeon to the patients. Instead, if the anesthesiologist does this as a very in a very approachable manner with giving multiple options like this. See, there is option of regional anesthesia also instead of GA. Which one you would prefer? See, today the patient was it was a spinal anesthesia case, what we did today. But patient was so much anxious that he himself wanted him to be knocked out during the surgery. So Dr. Govind made sure that he gave a very good sedative during the anesthesia. And once he came off, he didn't realize what really happened, the entire procedure. He was so happy. So all these things can be made sure only by talking to the patient beforehand, not in the OT or before going to his ward and checking the patient in detail and make sure that surgeon has not missed out any vital things and give him options, talk to him. And during anesthesia also explain him, see, I'll be giving you oxygen for quite a few minutes and then I'll be intubating. And even after spinal anesthesia, very important. It's not all about anesthesia only. Post-operatively, you will have like urinary retention for first time. So your legs may be very heavy. So explain these things to them. So they feel very kind towards the approach, and they'll be very happy and they'll remember you for their entire life. So that's how you can make some good anesthesiologists may always make their presence felt and make the patients remember them forever.
Absolutely, absolutely, Kishan. So developing a rapport
Yeah.
is something, these soft skills have to be taught even in MD program. So so we do that in our institute, these soft skills of communication skills and other things. So uh, emphasis on developing a rapport with the patient and making him feel comfortable even in the entire perioperative field period is very important. So, and with the rising anesthesiologists are also not spared when it comes to the litigation. So don't think that it's always green or whatever. So we are paying hefty amount as professional indemnity. So litigations are also very high when it comes to this field. So because it carries a lot of risk. So something you have to be extremely careful throughout the procedure, and you have to explain to the patient what you are going to do. And post-operatively, as Dr. Kishan told regarding the urinary retention, and when his if it is spinal anesthesia, when his motor blockade with the wear off, and will he be able to move his legs and pass urine and walk, is all these things we have to explain properly prior. That also helps in developing a rapport. So he'll also be very comfortable with you during the perioperative period. Okay. Yes.
There is such a young boy, 20 years old. He was so happy with the anesthesiologist more than the surgeon, just because he gave him like the entire procedure. He made sure that like he didn't realize anything, and the patient was very happy. Well, looking at that, when the patients are happy, we are also very happy. When the surgeon is very
Absolutely.
happy,
Yeah.
all are very happy. So that's very important. You really play a very crucial and very vital role in all the like patient management. Especially, see, those are the cancer patient when they are suffering. The only suffering is pain, chronic nagging pain. So that
Yes.
time you give them some plexus block or something, so which will
Absolutely.
relieve them, and their quality of life improves so much so that they are near normal in the rest of their life. So you make such a huge difference in everyone's lives. So, and your concluding remarks, Dr. Shilpa and Dr. Govind, please, to all the your
Subject.
motivational remarks.
Yes. So gone are the days when we are the people behind the screens. So
Yeah.
thanks to COVID, I would say that everybody knows who an anesthesiologist is. So um, it's a wonderful subject. I would say still that it is an end specialty, though multiple new avenues are opened. So you have an option. Uh, so you can choose this field if at all it's an option for you in your NEET counseling, is what I would say, because it will not disappoint you. And uh, now it's been more than 9 years, 9 years of my practice.
If you
So
are disappointed, you don't not married another anesthesiologist.
so
We are
very
both.
success.
Yeah,
You
we
are
are
so
both.
happy about anesthesiology, and you want to add up the or multiply that happiness to be married another anesthesiologist
Yeah,
partner.
we are both anesthetists by choice, which happens
Okay.
very rarely.
Yes.
That's okay.
Dr. Kishan,
That's okay.
this is what for
If
me it was
marrying
by
another anesthesiologist, you should make sure.
anesthesia was my choice. Actually, I had other subjects also, but anesthesia was my choice. So I loved the subject. So it is one of the most sought out. So it is a very beautiful subject, very good. So if you are very smart and hardworking, you will be very, very successful in this field. And I would convey my best wishes to all the budding doctors
Thank
who
you.
I know this is a very popular platform, the White Army. So I would convey my wishes and to all the budding doctors. And if at all anesthesiology comes up as your one of their options, please go ahead and take it.
Yes, Dr. Shilpa.
Yeah. So I would just like to conclude by saying we all need that adrenaline rush, don't we? Otherwise, life is pretty boring. So go get your adrenaline rush. Anesthesia is amazing. It will keep you on your toes and something to look forward to every day. Being a lifesaver feels amazing when so many people are dependent on you, and you are required to do so many surgeries where surgeons are waiting for you to enter the OT and anesthetize that patient, where the patient is really happy with you that he had a pleasant pleasant experience even when he's going through such major procedures. It feels really great. It's a very gratifying subject. As I already said, we both are extremely happy and we would not regret taking up anesthesia, nor would you. So definitely go ahead. You would be a little worried about the stress, the anxiety, and the seriousness and the things associated with that. But with time and experience, you'll be able to handle all of that. So definitely go for it. Hoping to see all of y'all in the future anesthesia conferences very soon. And congratulations.
And many will keep you in mind, especially for saying that anesthesiology is the second highest paid branch. For that, definitely everyone will remember Dr. Shilpa and they'll tell, Madam, you are right. I'm making
don't catch me if you don't get paid that great, but I'll also give you the tips and tricks how you can make it better, work better for you in your favor. So also, I hope I get to meet you guys sometime where you come up and tell me that you have taken up anesthesia for this. And congratulations to Dr. Kishan doing a great job with the White Army, influencing a lot of people towards the right path. So we are glad we got an opportunity to contribute to this venture. Thank you so much for having us, and all the very best to all the young minds. You all are going to do great.